Researchers have identified different behavioral patterns associated with emotional eating that give us some idea about how to best respond when we're faced with strong emotions. In particular, two patterns of responding appear to be seen among individuals who engage in emotional eating. These patterns are called emotion-oriented coping and avoidance distraction. Emotion-oriented coping refers to a way of controlling emotions through emotional responses, fantasizing, and self-preoccupation. This refers to what is known as rumination in behavioral psychology terms. It's when a person continues to think about stressful events over and over again without arriving at a solution to the problem. They fantasize about what they could have done during a stressful situation and worry about what happened. This type of reaction also tends to be associated with different levels of intensity among depressive and anxiety disorders, with a greater level of rumination associated with more intense symptoms of anxiety or depression. Now, avoidance distraction is another form of behavior associated with emotional eating. It consists of distracting with another task or distracting through engaging in social activities. Although engaging in social activities when one's depressed may be helpful, trying to distract from problems through social activity or other tasks appears to be related to an increase in emotional eating. Well, we've talked about what is associated with emotional eating, but obviously it's important to understand what is not associated with emotional eating. At least one group of researchers found that task-oriented coping is not associated with emotional eating. Basically, task-oriented coping refers to dealing directly with a problem causing distress rather than avoiding it or turning inward to fantasize or ruminate about what has happened and what one wishes would have happened. This leads us into problem solving, which is up next.